Take a seat.
I think at hospital end, rate measures will be stricter with visiting. We probably ban visitors or whatever, So we may not do so at this stage because, there's no evidence of community spread. There are a number of measures which are tightened up, but at the hospital end, when it comes to even yellow, orange, it's already quite strict. Yeah, quite strict. But my point about not being locked into SARS mindset was to make a point that what is appropriate for red in the case of SARS may not be totally appropriate for this particular swine flu. So these are the variations that we need to work out, which we have to debate through day by day, which we are. So it doesn't mean that the red of SARS will be completely red of swine flu. Yeah. So I think leave us the judgment because we know the subject much better, and we would moderate. We may strengthen, we may weaken some of those measures. Yeah.
Mr. Cole?
Yes, where are you?
Yeah, I'm here.
Yeah.
Yeah, you mentioned that those with a travel history to Mexico over the past 7 days will be quarantined. So I was wondering, at the moment, is there anybody that's being quarantined at the moment, being served with a home quarantine order?
At the moment, no. Not yet. Not yet.
So to clarify a point about the schools and workplaces were encouraged to conduct their temperature checks. So we know for now that it's not compulsory. Is the government going to take a lead in instituting routine temperature checks in government buildings, public spaces? And the other point I wanted to clarify is, when you say mass gathering, do you have a specific number in mind? And going by that, for the Istana Day open house tomorrow, are there going to be temperature checks or thermal scanners or anything along those lines?
I'm told Istana side decided to put some temperature checks. Just a precautionary measure, and that certainly will run into big numbers. Mass gatherings. I don't think we need to specify a number. Is it 10 or 100 or 1,000? But what is a mass? What is a mass? But I think let's work with your common sense, and also make a distinction between outdoor and versus indoor. Indoor, of course, the risk is much higher. Outdoor, then it's a bit less. So I think we have to play by ear. A lot depends on whether there is evidence of community spread. So that is our job. And fortunately, we have always have flu typing for flu influenza surveillance. So we have been studying the figures all these weeks. That it seems to be still very much a normal pattern. But these sort of things can change very rapidly. I think my key message is this is a fluid situation. It can just change very quickly.
So public buildings will not be having
very sorry. Sorry?
Government buildings will not be having checks.
No, it's a matter of time. It's a matter of time, sorry. But it's a matter of time, because unless suddenly the virus all disappeared, and the whole world go back to a pre-March day, which I doubt it very much. But I think gearing up for temperature checking is important, so that when you need to actually seriously do it, everybody do it, you have at least the thermometers around and the recording system. So that is the value of what we are doing in the schools, is to make sure that at least you have the systems and the equipment on hand. It is for that purpose. Yeah.
So would you give us an update of the hospital situations in Singapore, how prepared they are, public and private?
I think they are all gearing up. We have been gearing up since the weekend. So I think winding down elective surgeries is part of that purpose. Yeah. So whether you are prepared or not depends on how the external environment is like. Are you prepared for red? We are not yet, So, but you have to begin to quickly gear up for red or black. So preparedness depends on what is the demand.
So they'll bring down occupancy to what level, so that they have how many beds available?
Frankly speaking, when you go into red or black, many patients will run away. This is what we discovered in SARS. 1/3 of the patients just disappeared. So Singaporeans, they are very alert to what is happening. Yeah. Sorry? What?
Hygiene.
Yeah.
In Hong Kong, they started scrubbing.
public places and scrubbing down and everything else. I remember during SARS we had the Singapore OK campaign. Are we going to do something similar?
Yes, I believe so, because this come under environment. Minister Yaacob, who is away, in fact I'm covering for him for the next couple of days, and NEA is all geared up for this weekend. Remember our hand washing in the hospitals? Tan Tok saying with a car prize to be given. So all those are various activities that we are doing. Some high profile, some low profile without media coverage, but it's happening, for example, in kindergartens, in childcare centers, in schools. So all those, I think, are good efforts. You know my view about public health or personal hygiene. I think we should be like the Japanese. We are not yet there. This crisis is as good a time as any to get Singapore up to mark.
Do you have any advice for the Chinese patients or for the public who are going to take up the TCM?
Yeah, I think we treat all patients alike, whether you go to Western clinic or Chinese physicians, and that's why our guidelines, instructions to GPs also apply, and we share them with the TCM physicians. Yeah.
So I would like to find out
on the business of gearing up for this weekend. What is happening this weekend that NEA is going to do?
I think they're going to do the toilet OK, hawker center OK campaign, I think. Sorry, I don't know the details, but you can check with NEA. I'm sure they will be able to brief you. And I think they want media coverage too, so that through you to reach out to all.
School holidays are coming.
Yes.
And many families have planned their trips overseas
Yes.
to many of these affected areas. So what advice do you have for them?
Yes, I think certainly if your trip is to Mexico, I would advise no lah. So depends. Yeah. So I think key point is this thing will keep on changing. So you have to expect that you may have your travel plan may have to change. Depends on what happened next week. I do not know what will happen next week. So I think obviously as consumers you have to anticipate that there may be your traveling plan may have to change. Suggest go to Sentosa.
Sir, you said that it won't be long before, you expect it won't be long before deaths and confirmed cases here in Singapore. But there have only been 22 suspected cases so far. Are you expecting a new wave of suspected cases? What makes you so sure that there'll be deaths here?
No, I'm not saying I guarantee you there'll be death next week. I'm not saying that. I'm just saying I think we should mentally prepare that these things may come, almost will come to Southeast Asia. And if you look at Southeast Asia, which are the most globalized countries or cities, I think it's Singapore, Bangkok, in terms of international jet airline network. So, and that's exactly what happened during SARS. We were the first in the ASEAN country to have an index case, followed by Vietnam, I think, yeah.
So I would like to find out, because we are using the exclusion method now, is it that you can only have one type of flu at a time? And also, would there be a 24-hour media center set up so as to answer our queries?
Okay, yeah.
When you mention one type of flu, what can you clarify, please, what the question is?
Now we are trying to type A or subtype.
No, I think right now there is also the seasonal variation of the flu. So there is influenza A, there is influenza B. And even in influenza A, the subtypes of it, there is an H1N1 and an H3N2. These are quite common. Up to about 10% of all upper respiratory tract infection is due to influenza currently. We do a surveillance. And when we find that there is this 10% that is influenza A, we also subtype them. And we find that all of them currently can be subtyped into either H1N1, that is the common variety that is going on, or H3N2. So really, even in our background surveillance, we find no untypable type of influenza. Oh yes, that is exactly what is happening in Mexico.
I think what she meant is the same person.
The same individual?
The same individual.
at the same time, that both well, it's a hypothetical question, but I think it is possible. That is how at least in the animals where this mixture of viruses take place, it's because of the presence of two different types of viruses, and then they mix, and then they mutate. Yeah. Beg your pardon? Yes. Oh, that must be an extremely rare possibility, but it is possible. Yeah.
I think let's take a practical approach. Yes. What is theoretical, of course, anything is possible. As somebody just suggests to us that should we not all travelers that arrive in Singapore just take a swab of their specimen and then do a testing? Of course, theoretically, because you are now living to self-declaration. Where have you been? And the easiest is to do a swab of all the samples and do a test of all these millions of travelers who go through. But it is not just checking the samples. It's not just the laboratory capacity of doing so, even if you can organize it. It is not just taking, because I got to wait for several days before I can confirm, are you not with swine flu? So meanwhile, I got to quarantine you, right? So therefore, how practical it is. So I think these are some of the practical things. I think let's do what is practical, what is best practices. And of no doubt there will be always very, very rare possibility of this and that. And we just got to live with that kind of a risk. Yeah.
I understand ASEAN is having this meeting on...
I think it's a proposal by ASEAN, Secretary SecGen, is it? Dr. Surin, is a proposal by them. Whether there will be a meeting or whether there will be a physical meeting and where to hold it has yet to be decided. Yeah. So, but there's going to be a WHO meeting in May. So one suggestion is at the margin or at the back to that meeting that they could always have a gathering.
So there's a mention of this dedicated ambulance service 993. Can you tell us a bit more about this? Are the ambulances specially retrofitted to bring these patients to the CECs? And who's running them?
Yeah. This was an innovation that we started during SARS, so that you have on-demand service. And whether you need special protection, I suppose there are some basic protection needed. But more importantly is to ensure on-demand service, and so that when you call, they come and send you to the right place. So that was started during SARS, and we just get the system up and on standby again.
So no one is under home quarantine yet?
Huh?
No one is under home quarantine yet?
Not yet, right? As soon as we have a traveler?
But you get a few hundred every month, right?
No, well, it depends. During this period, probably numbers go down, but yeah, we have been told of a handful that's coming back, so they'll be the first batch on home quarantine soon.
What will trigger your next increase in your response level? Is it going to be a confirmed case?
Sorry?
What will trigger the next increase in your response strategy, whatever it is? Is it going to be a confirmed case? Is it what would be the next level? What would trigger the next level, the right level?
There are objective criteria. This is even WHO's alert level. There are objective criteria. So that's why we all anticipated this level phase 5 alert, because you look at those objective criteria, you know that in fact they should have declared maybe 2-3 days ago. So, but of course the usual, you have to meet and negotiate for announcement by the experts. So there are objective criteria out there. You can check our website. You will see that what are the different levels and what are the objective criteria.
So yeah. It appears to me you do have some kind of estimate of the number of travelers from Mexico.
Based on past history.
What is the past history?
I can't remember numbers. It's a few thousand a year, I think.
A few thousand a year?
Yeah. I don't know. I don't have the figure.
Generally Mexicans themselves?
Not necessary. Not necessary.
What will you do with Mexican tourists who are coming to Singapore to visit?
Same thing. We treat all travelers rather than by nationality. Yeah. It has to be by travelers.
Do you get an update on whether there are any efforts to try and work out a diagnostic test either by CDC or any other scientists?
Yes, there are standard way of doing it, and we have those capabilities. It is just that because we don't have real patient with real samples, so you cannot be sure or certain that this thing actually works, because you have to do control testing with your test, so that positive is positive, negative is negative. So without a real viral samples from real patients, we cannot confirm that. But we will be getting them.
So most of these travelers are actually here for less than 7 days in their expected journey.
Yeah. So I suppose they won't come here, yeah, because it makes no sense to come here to be quarantined. And that's why you see those many responsible multinationals begin to have advisory for their staff, you know, and make use, like during SARS, make use of Skype, make use of internet, telephone, teleconferencing.
Are the polyclinics gearing up for this?
Yes, they are.
What are they doing?
Yes, they are. I think with this alert, the major change for them will be begin to. I think they have to take swab samples.
They have got right now triage, so they divide them into fever and non-fever clinics, and the healthcare workers would be appropriately dressed in PPE. PPE, yes. So they'll wear a gown and gloves, yes, and mask. Yeah.
Haven't got the general practitioners involved in this exercise?
So yes, the general practitioners have been involved from the very beginning when we had informed them, and they have helped us identify some of the travelers and have sent them to CDC for further tests.
I think this was an enhancement compared to SARS. SARS at that time, everybody was just ill prepared. So we had the benefit of involving GPs during the last 6 years, and they have been. In fact, I should take this opportunity to thank all our medical practitioners and nurses, private hospitals, private GPs. They have been very good in cooperating with us. Yeah.
Take a seat.